Assalamu alaikum and welcome to this video by me, Dr. Muhammad, and today we'll be talking about COVID-19. Now, you've probably seen lots of information about what COVID-19 is, how to treat COVID-19 and some of the signs and symptoms, and I'm not going to be here giving you that information. But today I'm going to be talking about my own reflection, which I think is important for us all. In treating patients with COVID-19, I've really come to understand the different lifestyle factors that can contribute to the severity of disease. When I look into my own life and the lives of other people around me, I realise that the lifestyle that we're living with respect to our diets, our food intake, our sugars, our exercise, really make us susceptible to having some of the worst strains, not only of COVID-19, but also of other types of diseases. And here we're going to explore some of these different things. The first thing is our diet. The fast food culture that we're surrounded by, as well as the busy lifestyles that we live, has made us really neglect our diets. Whenever we go to supermarkets, for example, the aisles full of fresh fruit and produce are often full, and the aisles full of frozen goods such as pizzas, fish fillets and also chips are often empty. And that's testament to the busy lives that we live, but also the neglect that we have with regards to our food. Now, we often forget that a lot of these long-lasting foods that are quick and easy to make are often packed with high concentrations of salt, really high levels of fat, and all of these things can contribute to us getting something called high blood pressure. Now, high blood pressure doesn't really sound scary because we don't really feel the immediate effects, but some of the sickest patients that I've dealt with as an emergency doctor have had severe blood pressure problems. And they're not very old, they're about 50 years old and some even early 40s, but they haven't necessarily looked after the types of food that they eat. It's often frozen food, microwave pizzas, pot noodles, and really fast food. And I appreciate it's difficult. None of this is helped by the fact that we always get messages on our phone with free delivery options with regards to takeaway, but we really need to look after our diets. A really simple thing that we can do is try to actually make food ourselves. Buy fresh produce and fresh ingredients and just find some quick recipes on Google. BBC Good Foods has some excellent quick recipes, and just pick a few out of them and just try to make them. And you'll find that you'll feel better in yourself and you'll go a long way in saving yourself from developing bad disease. The second thing is our sugar. Now, I'm sure you've been to a GP consultation and someone's told you about your sugar intake and the fact that you really need to look after your sugar. Now, in my culture, eating sweet things is the norm, and it's really difficult to run away from that. But we really need to look after our sugar intake. Chocolates, crisps, confectionaries are really easy to just pick out and buy from vending machines, but can have some catastrophic effects because they contribute to something called diabetes. Now, if there's any disease that I want to run away from, it's diabetes, because diabetes increases your risks of having every disease under the umbrella, really. And if you don't want poor vision, crusty toes, as well as really bad kidneys, we should really try to make some drastic changes to our diet and especially our sugar intake today. So do simple things. Maybe substitute a packet of crisps for some grapes, for example. Find some things that you can live without and that you can actually just substitute for a healthy alternative that has minimal sugar in it. And I'm telling you, it will not only protect you from something like severe coronavirus, but with regards to any disease that may come up in the future. Another issue for sure is our exercise and our level of activity. And I know it's really difficult when we work busy jobs and we come back at the end of the day, the last thing we want to do is go for a walk or go for a run. But it's incredibly important because COVID-19 works by restricting oxygen levels, and it's this restriction in oxygen levels that can make people really unwell. Now, the best way to protect this is to do what I call lung stamina, building up your stamina with regards to your breathing. And the way you do this is by getting fresh air, going out on regular walks, going on runs, and trying to oxygenate yourselves and bringing as much oxygen into your lungs as possible. So that if you are unfortunately struck with coronavirus, you have enough lung stamina and enough oxygen and enough in you to really go through the duration of the disease without feeling much of an effect, of course. So let's try and get a bit active. Maybe plan some segments of your day where you can do 10 minutes or even 15 minutes of focused activity so that you're getting your lungs pumping, you're getting that oxygen in and that carbon dioxide out, and that you're truly creating that circulation within your lungs. So I hope that's been beneficial, and really it's been a reflection of mine, and I've been trying to implement it in my own lives, and I feel it would be beneficial for yourselves as well to make some of those changes in your lifestyle, in your diets, to protect yourselves not only from coronavirus but from anything that may come in the future. So please do like and subscribe and share with family and friends, and hopefully we can all benefit from this together. Thank you very much. Wassalamu alaikum wa rahmatullah.